Rosa Sue Lucas. I am a bilingual family nurse practitioner. I'm a founding board member of the Coachella Valley Volunteers in Medicine, and my work is at Eisenhower Urgent Care Clinics. When I came here over 30 years ago to the desert with my family to open medical practices, I saw the need in the East Valley, and I knew we needed better health care here. So I decided to use my motto, think globally, act locally. And I just started doing work in the FQHCs, my own practice, and just kept on going, knowing that things were going to take a really long time to get done, and made a commitment to doing that. When we were opening up a federally qualified health center in Oasis, Dr. Ron Hare said to me, "Rosa, don't you think we need a free clinic in the East Coachella Valley?" And I said, yes. So he started working with Roy Wilson, our departed and beloved Old County supervisor. And Ron said right away, fine. We don't take insurance. We only see the underinsured and the uninsured. We don't take anything. We live off grants and donations, but they gave us our building. It's beautiful and light and spacious and has nice art and beautiful people in it. So that's how it started, and it took us till 2010 to really get it off of the ground and to start seeing our first patients. We were in a medical salon which meets once a month. It's called Finding Meaning in Medicine, and it's for people who really like the pureness of medicine and are trying to recapture the essence of what we love to do, which is heal people and try to get away in our heads from the business of medicine. So most of us who were in this group volunteered there, and we started talking about wanting to help the homeless. A couple of months later, we just started to do it with what we call the magic box, of mostly Band-Aids and things like that. And then we just went out the first time after the board approved it, and we did it. And then it just started growing, and we got the board approval for some funds, and which we need more of course, always. And that's it. And we've been going out now 126 consecutive Tuesdays and a few Saturdays, and meeting the challenges of taking care of people in the desert and the dirt. What we see when we're out there is very hard to describe because it's not a part of our realities for most of us. Because most of these people are ill. It is not like they decided one day, oh, I just don't want to work anymore. It's not like that. Some tragedy happened in their lives, or they have mental illness or became addicted to a substance. Their lifespan is 15 to 20 years shorter than the average American because they're not getting their diabetes, hypertension, their infections, anything that would not be such a big deal. I don't fault people for going to other countries to do medical work, but here there's still need, and if we could just stay here and do the work step by step in our groups, in so many of the organizations, for me it's the pure joy of service, of doing medicine without worrying about billing and coding and bonuses and time per patient. I don't want to think about that out there. I don't need to. Everyone who goes out there feels really happy at the end. And then we feel compassion, but we feel so glad that we were able to do a few things.